Can you please tell us about a time that you had a difficult patient?
Yes. So whenever I have a difficult patient, I always just try to remember that they may be hostile or upset because they're in pain, they're away from their families, or they're just in an unfamiliar setting like the hospital. So I did have this older gentleman who came into our hospital because he fell and he broke both of his legs. And at the time, families weren't allowed to be at the bedside. So when me and the nurse were in the room trying to clean the patient up, he became very agitated. He tried to spit at us and, call us names. So I knew that we weren't going to be able to change him at that moment. So I suggested to the nurse that we try to call his family and get his family on FaceTime. I knew he had a daughter, and I figured we should just try and see if she could talk to him and help him calm down. So we got his daughter on FaceTime, and I told her what we were trying to do, and she talked to him, reassured him that we weren't there to hurt him or anything. We were just trying to help, and we were able to successfully do our job.
Awesome.
There was a time where there was a frequent flyer, and upon his admission, all like the staff were like apprehensive about this patient, and they told me to
Sorry, I
avoid.
wouldn't say frequent flyer. I would say a patient that then the staff was very familiar with because they had had multiple prior admissions.
Okay.
Okay.
So there was a patient who the staff were very familiar with because he's had multiple admissions to the unit. And it was my patient. So upon going into the room, one of the staff members told me in the past he's been very verbally and physically aggressive. And I went to the room and did my initial assessment with my preceptor. And I could tell that the patient was a little angry and he was kind of resistant to talk. And he just began like saying different things that weren't necessarily the nicest things to say. And I knew that anger normally stems from somewhere else. Maybe it's because of a feeling of feeling unheard or just not knowing what's going on in the situation. So I sat down with this patient and I just asked him what was going on and how he was feeling, and if there's anything that I can do to make this a little bit easier for him, because I know that it's a scary place to be and it's not everyone's favorite place to be admitted to, but I really just empathized with this patient, and he told me that everyone just ended up touching him and not really telling him what was going on and doing things to him without asking first, and that's something that made him feel really uncomfortable and frustrated. And I empathized with him because if I was a patient in his position, I probably wouldn't feel comfortable with people just touching me and not telling me what was going on either. That is something that would make me feel really scared. So I told him that in the future, every time I come in, I will make sure that not only I, but everyone else informs him of what's going on and tells him the reasoning of why we're putting on a blood pressure cuff and what it's doing and how it's going to work, because that's something that he should feel comfortable with and be involved in his care with. And after that, he was a great patient. He ended up joking with me during the shift. He became a lot more open and willing to share his emotions about everything. And I don't really.
Yeah, like maybe he shared a little bit about his life. Maybe he shared with you how his journey has been so far in the hospital and, the things that are upsetting to him versus what he prefers, and was able to kind of build that trust and rapport with you where he didn't have to be on guard, always worried that someone was going to do something to him without telling him first.
Yeah, I think it's because of like the past visits he's had kind of impacted this visit. And
Mm,
that's like the feelings he had previously. And I feel
yeah.
like that's something that scared him. So
Yeah.
that's why he was acting the way that he did.
You could mention, since ERs tend to like this, that you made sure to, because you had heard that this patient on a previous admission had, that you made sure to never put your back to the patient, to always make sure that you would be able to leave the room quickly if you needed to for your safety. And then you made sure to put a sign on the patient's door, please talk to the nurse before entering the room. So the safety stuff, and then, yeah, just making sure he feels heard, valued, making sure that he doesn't feel like he has to be guarded at all times because people might come up to him when he's asleep and just grab his arm for a blood pressure cuff or stick him
Yeah.
with something. Like that would make someone really on edge.
Mhm.
If you want to download my list of 72 new grad nursing interview questions, that PDF is linked in the description. Don't pay full price for it as a supporter of the channel if you use the discount code YouTube. It's only $3. I made it all cute and aesthetic for you guys. It's 22 pages. The idea is hopefully interview day won't be the first day that you encounter whatever question they ask you. I've included every interview question I've ever heard of that any new grad has ever been asked. Don't pay full price for it. As someone who supports the channel, you get it for only $3. Just use the discount code YouTube. Another super common one they'll ask is, tell us about a time you had a difficult patient.
I had this patient who had a surgery on his right leg, so she wasn't really able to walk around without assistance, and sometimes she's on the wheelchair because she really cannot move the leg right away. So one time, I heard her like shouting, screaming, and even like when they about to give him medication, he doesn't want to take the medication, and he was just like very upset, agitated, just screaming. And then, but I had this patient before, and he wasn't like this. So what I did is like, hey, what's up? What's going on? I heard like you're screaming. Is there something wrong? And then I told, and he told me like, well, I'm kind of suffocated in this hospital. I've been here. I want to go home. And then, but they keep, these people, just these doctors, they don't want to let me go home. They don't want to discharge me. And they said, well, we're doing the best that we can because we want to make sure that you feel better and you recovered before you can go home. And then, but is there anything I could do right now to help you? And then he said, he opened up and said, well, the truth is, I feel so suffocated here because it's like he's claustrophobic. So being in the hospital and then the windows are closed there. So he feels like claustrophobic. So he said, I cannot breathe. I feel so suffocated. So I said, so at that time, here's what can I do. Let me talk to your primary nurse, which is my nurse preceptor, and we'll see what we can do for you. So I talked to my nurse preceptor and talked to her about my patient concern. And then he said, well, my nurse preceptor said we cannot do anything about it because he's not allowed to go outside. So what I told my nurse preceptor, is it okay or is it safe if I just wheeled her around on his wheelchair and I will accompany him, like just looking at the window, because on that hospital we have like a big windows looking outside, and maybe that could help him just like see a different atmosphere. And then so that's what we did. My nurse preceptor helped me get the patient safely to the wheelchair, and I walk around the patient around the unit, and he was like saying, this is so much better than inside my room. So I only have my roommate who's not even talking. And I said, and then he was actually, after that one, he feel much better, and then he's even more cooperative taking his medication, and he was actually very thankful to me because a while ago he was doing this screaming thing because he keeps pushing the call light, but then nobody like really listened to him. Like they always ask him, well, what do you need? And then, but he cannot really open up what he really needs. He just really want to go out. So I'm glad that I listened to that patient, and I learned from this situation that being an active listener and being make sure you also assess what your patient needs with no judgment. You can help the patient to be compliant and cooperative with their treatment. And that's what I've learned from this situation.
I love that. I love the last sentence too, about no judgment and like helping them, to strategize with them a way that they can get the care that they deserve. Yeah. Can you please tell us about a time when you had a difficult patient and what was the outcome?
Yes, a time I had a difficult patient is when I arrived to the unit and I got my shift report, and the nurse doing handoff told me, heads up, this is a difficult patient. He was really unhappy with his care and he just doesn't want to nurse today. So yeah, this patient's hard. And so I walked into the room, and right off the bat, I could tell he was very unhappy I was there, and there was just a really negative energy. And I really wanted to minimize conflict as much as I could and just de-escalate the situation. And so I decided, just before I did anything at all, just to talk to him and figure out what was wrong and the emotions which his actions were stemming from. And so I started talking to him, and although it took a bit for him to warm up to me, he ended up telling me that the reason he was so unhappy with his care is because he didn't like people just like coming in and startling him and touching him and doing things without them like asking him first. He said that like a lot of the people were coming in and pulling on his arm to take his blood pressure and on the IV lines. And he said it just ultimately scared him and made him feel a bit helpless. And so I thought about what he said. And when I stepped into his shoes, I realized that, yeah, I wouldn't like that either. And so I just asked him how he would feel if moving forward, I asked him before I did anything and got his consent and told the rest of the staff to do that as well. And he said that would make him feel a lot better. And so moving forward, that is exactly what I did. And it really just turned around the shift. And he ended up being a great patient. And we bonded over our shared love for hiking.
That's cute. I wouldn't end it there. I would say how you want to handle things going forward, or like that it taught you X, Y, and Z, maybe something about listening, about how much of a difference it made to actually be the one to take the time to listen to what they have to say, just to bridge it from like totally being awesome in that situation and like what you'll take away from that situation going forward.
Oh, okay.
Yeah.
So like from that situation, I realized that just taking the time to talk with patients and truly listening to what they have to say, it can have such an impact on your relationship with them and really just improve your relationship and how they like the care.
Yeah. And then, you know, if you want to end with the thing about hiking, that's cute too. Sometimes it can be, if you can do it in a way that like doesn't make them uncomfortable, cute little like things like that that are a bit different, that show your personality, can be what makes them feel like they connected with you. So when they're going through their list later of like, who do we have to eliminate? They're like, oh no, but I kind of liked her. She said that cute thing about like hiking, and like we had a couple good laughs during the interview, and it kind of helps them maybe choose you over someone who is equal with you in like everything else, you know, because you're the one that's like,
Okay.
oh, I like, we connected.
Got
A hiking
it.
girl,
Okay.
right? Like
Hiking girl.
so these two are super, super common. I feel like almost all hospitals ask these next two. So can you please tell me about a time that you had a difficult patient?
Okay. A difficult, oh man, I've had a
And
lot
by the
of
way, when they
difficult
say this,
patients.
they're not talking, this is not like a critical patient.
Could it be like a patient's family member
Totally.
that's
Yeah.
in the room? Okay. All
Yeah.
right. So a time that I had to deal with a difficult patient was when I was providing wound care to my patient. My nurse had told me to go inside the room and do some dressing changes for this patient. So when I went in, I started gathering all my supplies and started, doing the wound change on them. And as I was doing it, their family member was in the room, and I can tell they were kind of watching over my shoulders. And I felt it, and I turned around, I asked them like, "Oh, did you have a question?" And they kind of started challenging me a little bit. They're like, "Oh, well, you're not doing it right. This isn't what the other nurse did." So I just reassured them at that time. I'm like, "Okay, well, I am doing the wound change to the treatment plan and what the doctor ordered." And I started just explaining like step by step what I was doing in that moment to the family member. And by the end of it, what happened was there was a change because the wound had gotten better, and no one had informed the family member of the change. So when I found that out, I just let them know. I was like, "Oh, I'm sorry that no one informed you of this change." And she just thanked me for just being super detailed and just explaining the process with her.
Yeah, I think that's great. And then I think you could finish it out by saying what that taught me is that a lot of times family members feel protective of their family member because it's a really vulnerable time for the patient, and really what they want is to help. So if you kind of bring them into the fold as part of the care team by explaining what you're doing and the ways in which these things are helping, and reassure them that this is what the doctors have ordered, and just letting them feel like they're kind of part of the team by explaining things to them. I've learned that can really help meet their emotional need of feeling like they're involved and they're helping and they understand what's happening, because the hospital can be a really scary place to be, especially when you don't feel like you're informed on what's going on.
I like that. Okay.
Like just something that you learn from it that you will carry forward through whatever kind of interaction comes up.
Yeah, absolutely. And I
Yeah.
feel like just even, now you're right. Like after that, whenever I would go into a room with a patient and there was a family member in the room, like I made it, a thing to just explain to them what I was doing while I was doing it. I
Yeah.
think as a grad, I would always just go in and just do it because I was like excited. But I was like, oh, wait, hold on. If there's someone in the room, let me explain to them what's going on. But
Yeah.
yeah, no, that definitely was my learning point from that.
You could say you found that's a really good opportunity to build rapport with the family members and
I like
also build their confidence in you, especially when you're a new grad and they may look at you and think, oh, you're young, or oh, I see you had a buddy nurse
that.
with you. Do you know what you're doing? Like this is like a really
Yeah,
good time to
absolutely.
build their confidence and rapport with you.
Okay. I like that a lot.
But I did have this one patient who was, so she was very confused and kind of combative. And a lot of the nurses were kind of avoiding going in her room because she tended to say a lot of inappropriate things. But I kind of took this as, hey, she needs extra caring. And so I know she mentioned something about her dogs, and I wanted to kind of bring in her dogs in a way to comfort her. And it definitely did. And she actually, right when I talked about her dogs, I just saw her kind of light up like, hey, how do you know about my dogs? And from there on out, it was kind of a way I could de-escalate her, and ended up being really helpful because we had to put in an IV on her, and I was just able to kind of talk about her dogs while they were putting in an IV, and just able to de-escalate that situation.
Cute. You know how, I'm sure you know this, you probably learn it really quickly as a CNA, like what works for one person doesn't work for the other person. You know what I
Oh
mean?
yeah.
Like, so you could maybe say
Yeah.
something that speaks to that, how like through your experience working with patients as like a CNA and MA and a nursing assistant, you've learned like what works for one person in terms of de-escalation doesn't always work for another person. So really like, taking the time to listen to the things that they talk about and like what they personally care about like helps you in those moments when you really do need to redirect them.
Okay. I like
Yeah.
that.
Yeah.
Yeah. So a difficult patient I had was actually, I just remember this today. I had a 3-year-old patient and he was so scared to be there. I felt so bad for him. Every time someone, a nurse, any kind of staff member in scrubs got near him, he would just cry and he just really don't want to be there. And my nurse asked me to go give him about like 12 milliliters of, I think it was like cough syrup or some kind of syrup. So I come in, I don't even, you can't even see the syrup. I'm just coming and try to say hi and like kind of build a little bit of rapport with him. And he immediately is like, sees the scrubs, is not having it, which is totally okay. So I kind of just explained to the parents like what the medicine is and tell them that he has to take it. And I asked like, oh, I can step out, kind of watch you guys if you guys want to give him the medicine. I would still be watching. I was just like kind of, I wouldn't be staying there right in front of him. And they tried and it really just wasn't working. So they gave me the medicine back to me. And I asked, can he have JUICE? I don't want to say the word out loud in case he couldn't. And then it turns into a thing. And the parents like, yeah, he likes that. And so I went and got some juices and I also got a Band-Aid and I took it off and then I drew in pen a puppy on it and I drew like other little like smiley face, cute little Band-Aids because we didn't really have any stickers on the unit or anything for like kids specifically. And I came back and I like kind of just talked to him slowly and I didn't show him the medicine yet. And I just was like slowly like trying to like, I just kind of gain a little bit of trust and show him that I wasn't gonna like force him to do anything or do anything to him without his permission. And he kind of calmed down a little bit and I kind of was like, oh, look, like if you take this medicine, you can wash it down with a juice. Do you like apple or grape? And he was a little bit more on board. He wanted the grape juice. And he still didn't really want to do it. And then I was like, oh my goodness, like look at these cool hospital stickers. They're just like little Band-Aids, little doodles on them. I'm like, look, if you take your medicine and drink the juice, you get to like put this on and everyone knows you were so brave and you did such a good job and you get to go home. So he agreed. He was like, okay, but I do it. And I was like, okay. And the medicine came in one of those little syringes, the oral syringes. So I took out a saline flush and I made him practice just slowly pushing the flush into a cup And then finally I was like, okay, you have to put it in your mouth. And he slowly took the medicine and then washed it down with the juice, and then was really happy to get the Band-Aid. And then luckily the family was able to be discharged. But even though that took a little bit of time, I felt that I was glad that I was able to just slowly get that child to warm up to me and be able to take the medicine rather than like just have like a parent hold them down and like do it, because I really value, just that patient's experience, and I want that patient to leave feeling better and not, I don't want to traumatize the kid, because I think if you can just go the easy route and like force the kid to take it and like not be as thoughtful about it, but I think it would make things hard in the future. And I was just thankful that I was able to get that child to comply, but without it being something like super traumatic for him.
Okay, I feel like this one is an obvious one they're going to ask. Can you please tell me about a time where you had a difficult patient?
Yes. So I had this one patient who, I had came into work, I got the report on him, and he had several surgeries, and it was just taking a little while for things to heal. So the patient was grumpy, he wasn't happy with the fact that, the nurses were coming in and just doing whatever they want to with him without speaking to him. So at the start of the shift, it's like a lot of staff were saying, oh, can we switch patients? I had this patient, da 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 da. And I knew that the patient still needed to be cared for. So it's like, yeah, I'll take the patient. So I ended up going in, speaking with the patient, finding out what his concerns were, and, just trying to decipher why the nurses were finding it difficult to care for him. So what the patient explained to me was that, just listening to him, he told me that, all he wanted was someone to wake him up before they slapped on the blood pressure machine to take his blood pressure, and he would cooperate. It's like, just let me know that you're doing something before you do it, because, that's one of the things that was missing. And so with that, the patient had used a few profanity words, and I let him know that, hey, I'm here to take care of you. It's not okay to talk to me that way. I will not talk to you in that manner as well. I'm here to help you. And so I did inform the patient before I did any invasive procedures or just even touching him, and the patient was cooperative through that. And so I was able to go in. He was still a little grumpy at times, especially if he would sleep. So I gave him a little time to kind of cooperate. I mean, just to wake up and allow these things to happen. So after that, there was no problem with this patient and me, and he just became more cooperative. And he also even opened up and shared some of his background history with me. So we kind of formed a relationship, and we had a few little laughs in between.
Can you tell us about a time that you had a difficult patient?
So when I was working as an LVN at a nursing facility, I worked the long-term care side most of the time. And during the pandemic, I had a patient who was nonverbal. She started stealing other patients' food as well as their stuffed animals. And it was just a really new behavior for her. And she also had a hard time communicating her needs because she was nonverbal. So we were trying to figure out what was going on. So I would give her extra snacks in between meals to see if that would help, and it did not help. She was wheelchair bound and started leaving the facility, and I would find her out in the parking lot, or sometimes people in the surrounding neighborhood would bring her back if she went missing. And so I was like, what is going on? So I started taking her for walks, which helped a little bit. And then it clicked that her who would visit weekly wasn't coming because of COVID. So I think she was just really missing him. So I called him and had him talk on the phone with her. And then we arranged for him to come meet with her through the glass door of her room. So he started coming weekly just to see her through the door. And after that, her behavior stopped. So that was like challenging, trying to figure out what was going on with her because she was nonverbal, but we narrowed it down eventually.
I love that you say the nonverbal thing, because if you do the NICU, your patients will be nonverbal and you have to kind of like figure it out. I like that you mentioned that. So maybe finish it off with something about how sometimes when you have, it just taught you sometimes when you have patients who are difficult and they're sort of acting out in ways that are making it difficult to give them the care that they deserve, that just kind of taking the time to assess what emotional need they're trying to meet and like struggling to meet for themselves is, and seeing if you can find a way to help meet that need so that they can get the care that that will help them have the best outcome.
Okay.
Just some way to bridge it from like, you handled that situation beautifully, but like, what about all the situations that are going to be so different? Like, what approach is going to fit everything? Cool. This is the one they always ask. Can you please tell us about a time you had a difficult or demanding patient, or a patient who was unhappy with your care, and what was the outcome?
Oh,
You gotta be ready for this one. They always ask.
yeah, I know. You gotta be ready for this one. There was one time where I had a patient where I had to basically be a sitter, and he was refusing and medications and being disrespectful to the female staff. And me being the only male on the unit as a student was assigned to give this patient, he liked me, like I stayed with him. I was having meaningful conversations with this patient, and at the end he took a liking to me, and I was able to give him all of his medications that were due, as well as provide like all the care that he needed, such as helping him go to the bathroom, as well as like as well as providing like a bed bath as well, when he would not accept it from any female staff.
So I like this. It can't be like just because you were male. Like it has to.
Yeah, I know. It cannot be. I know it cannot be like that. But I thought of that as like, that was a good situation.
No,
like,
100%. We're gonna use this, but like it has to be because, like, not just because you were like a guy and he was going to be rude to all the females. Like, don't even say like you got sent in because you were the guy. Just say like that you noticed like this one thing, and that helped you build a good rapport with him. And like, because you were the one who was like able to build a good rapport with him, they assigned him to you or something like that. And like, what was it that you noticed that he needed that you gave him that helped him kind of like be able to receive care? Like, did he need you to talk to him in a certain way that like the other people weren't doing, or like what was it about you other than that you were male?
I think I was like talking to him in a way that like that that's difficult, because I know that's a good situation, but I know he liked me because I was definitely asking him, you know, he wasn't there mentally, but I was like going along with what he was saying. He was like, oh, like saying the most this thing. I was just like, yeah, that's cool. Tell me more about that.
So you helped him feel heard and respected. Maybe you helped him feel valued.
Yes, let's go with that.
Yeah, you could say that like you could sense that he really just wanted sort of like emotional support and somebody to talk to. And like you were able to figure out a way to do that, and also be mindful of your time management. And like, because he felt heard and valued, he was more open to receiving care. And so when everybody noticed that like you were actually able to give him his meds and like help him, I don't know why he had a sitter, if he was like posing some kind of safety risk to himself or something, but like
he would get out of bed,
because you were actually the one who was able to like make him feel heard and like safe and like valued, that he like would actually stay in bed. So when everybody noticed that he was cooperative with you, they assigned you to just be his sitter and like help give his meds and all of that stuff. And that it taught you how important it is to
build rapport and build rapport with the patient. It taught me how to build rapport to the patient, as well as provide that make them feel emotionally supported and valued.
Yeah, and like just listening too, you know.
Yeah, absolutely. The first patient that comes to mind was a patient who I took care of on my practicum. And this patient they had come in for a PCI intervention. They had a stent placed. And this patient wasn't someone who went to the hospital regularly, went to the doctor. The nurse who was giving a report to us had mentioned that the patient had had a previous negative interaction with healthcare workers, a doctor. They didn't really give details about it, but they just said that this patient was really hesitant about the care that we were giving and just was asking a lot of questions. And I really wanted to make sure that this patient felt comfortable, because I can't even imagine, you know, I'm so lucky that I have been healthy most of my life and haven't really needed to be in the hospital. And I can't imagine, you know, having that kind of bad experience and then having to be in the hospital and all these people who don't know are doing all these invasive things to you. And I wanted to really make this person feel at home. And so I came in, I introduced myself, I told them who I was. I explained everything that I was doing and why I was doing it. And when the patient had questions, I would, you know, really try to answer them to the best of my ability. You know, I was still a nursing student, so there were certain things that I didn't know, and I would explain that I would, you know, get my nurse and ask her. And then just on top of that, we just kind of talked more just about life. And he asked me about, you know, my journey. Why was I in nursing school? I asked him about where he was from, and I just kind of wanted to build a rapport with him and really try to make a connection so he felt like he could establish some sort of trust with me. And I do think that that really helped, and the rest of the shift went well. And I do think, yeah, it was a very eye-opening experience. I'm very glad that I had that interaction.
Okay, so two pieces that we need for this.
Mm-hmm.
Typically when people say this kind of answer, they paint kind of more of a, like, patient was like intermittently refusing care, had been verbally aggressive with other staff members, like anything
Mm-hmm.
that you can say that kind of made it seem like even more difficult to like build rapport with them.
Mm-hmm.
Like, I don't know like what parts of that like would be true and you could add, but like that would kind of help
Mm-hmm.
story a little bit. And then at the end, you want to take some sort of piece where they'll like, you handled this situation beautifully, but like something that you'll take going forward. Like, you know, it taught me how much of a difference it can make when you really take the time to like to listen to their concerns and then like explain everything before you do it, and really like respect their space in that way and make sure that they're comfortable with the things that you're going to do before you just, you know, jump in and start doing your interventions. Like something where you're going to carry whatever you learned forward, like whatever it was that was meaningful to you, bridge
Definitely.
it to like every future future like situation that you'll have.
Okay. Yeah, that makes perfect sense. Trying to think of like a specific like barrier. I think really the barrier was just like, I don't know, in the report that we were given, it was just kind of like doing the assessments, like checking pulses, like every single part of like your head to toe. He would ask like, why are you doing this? Why are you doing that? And I guess maybe that was kind of like, it was just kind of, he was just hesitant about everything that we were doing.
Yeah.
I don't know if that helps.
Like, you had gotten in report that like staff had difficulty like providing care for him because at every step he would have objections, and would need redirection so that he wouldn't refuse care, because of just like a general lack of trust in like what people were about to do. Yeah, just make it sound like if you hadn't done this, like this guy would not have gotten care. Like,
yeah, okay. That makes more sense. Thank you.
Yeah. And can you please tell us about a time when you had a difficult patient?
So there was one patient, one of the very first clinical rotation. She was known to be difficult. The call light was on for a while, but nobody checked on her. So I asked my nurse if it's okay for me to check on her. I first check in with my own emotions because I really don't like to drag any negative feeling to this patient. I want to be as clear as possible when I, so that I don't make judgment in the wrong way. I don't want to have a cloudy mind. So I did that, and I introduced myself to this patient, and I assessed her needs, and she was basically really frustrated because she was a patient and she developed the right side of hemiplegia, and she was right-handed. So I tried to help her to promote her ADL, so she can do her ADL by herself, including like the reorganizing furniture or some. It wasn't major things that I needed to do, and she was saying some discomfort because she hasn't turned for a while. So I asked nursing assistant to help me because I was not familiar with the changing position yet. So I asked help and we worked together. This patient was really, really thankful. And she said she felt like she was heard first time in this unit. So I was really glad. And this patient really was, looking for me all the time. If she needs anything, we had a really good trusting relationship. And I really enjoyed working with this patient actually.
Okay.